proceed to the hair and scalp of the patient. So, in the hair, I'm going to look for its color, length, thickness, the distribution, texture, and the presence of dandruff, lice, and nits. And on the patient's scalp, I'm going to look for the color, the texture, and the presence of lesions. So, Miss Danica, I'm going to look at your hair. Is that okay with you? For the findings, patient hair is black but has dyed on the ends of the hair, and the hair is medium and falls on the above of the sternum of the patient. Hair is evenly distributed on patient's head, no presence of lice and nits, and head is symmetric, hard, round, and in the midline. It is normocephalic, which is appropriate to the size of her body, no presence of infestation such as masses, no signs of alopecia, and the scalp is clean, lighter in color, and it is not moist. Now I'm going to assess the eyes of the patient, and I'm going to look its eye structure, eyelids, the eyelashes, eyeballs, and eyebrows. Miss Danica, I'm going to look at your eyes and your eyebrows. Is that okay with you? For the findings, eyes are symmetrical, lid margins are moist, lashes are long, evenly distributed, but not curled upwards. Eyebrows are present and evenly distributed. Blinking is symmetrical and involuntary. Sclera is kind of yellowish, and cornea appears to be transparent, smooth, and moist. Pupil is round and equal in size. Now I'm going to check the visual acuity of the patient. Using this Snellen chart, I'm going to check the distance vision with Snellen chart 20 feet from the client. So assuming this is a Snellen chart because we don't have any Snellen chart at home.
E, F, P, A, O, Z, L, T, E, D, B, E, C, F, D, E, D, F, C, Z, P, E, F, P, A, O, Z, L, P, E, D,
For the findings, the OD of the patient, assuming that the OD of the patient is 20/15 and the OS is 20/20 with no hesitation, frowning, or squinting. Now, we're going to perform a vision assessment by checking for accommodation. To do this, I will have to ask the patient to stare at this pen light that I am holding 2 to 3 feet away from the patient's face. Miss Danica, I have this pen light, and can you please focus in this and follow the object as I move it? So for the findings, the pupils converge and constrict as the object moves towards the nose. Pupil response are uniform. Now I'm going to check the extraocular movement of the patient. So to do this, I'm going to ask the client to follow the object as it moves in a 6 cardinal fields. Ma'am, could you please follow this object as I move it? So for the findings, both eyes move in a smooth, coordinated manner in all directions. So I'm going to check the corneal light reflex. So first, I'm going to darken the room, ask the client to look straight ahead, and then shine light toward facial midline. So Miss Danica, could you please look straight as I shine light, this pen light toward your facial midline. So, but before that, I'm going to darken the room first. For the findings, illuminated pupils constrict. Pupils opposite of the illuminated constrict is simultaneously. Now I'm going to assess the ears of the patient. I'm going to inspect the external ears for position, lesion, and discolorations. And then I'm going to palpate the external and the mastoid process. And then the auditory function, the gross hearing ability. And I'm going to stand about 1 to 2 feet away from the patient, out of her line of vision. Ask the patient to cover the ear not being tested. Then I'm going to whisper words to the client and have them repeat those words. Na? Na?
Oh, okay, start.
Danica, I'm going to check your auditory function. I'm going to stand 1 to 2 feet away from you, and I'm going to ask you to cover your ear not being tested, and I'm going to whisper words, and you have to repeat those words what I'm going to say. Okay?
ABC 1. ACD 1 to 3.
So for the findings, ears are symmetrical in size and shape, skin is smooth without noodles, no lesions and discoloration noted. Non-tender urcle, mastoid process was easily palpated and non-tender. Client is able to hear whispered words from 1 to 2 feet. And now I'm going to assess the nose of the patient, and I'm going to check the external nose inspection of its shape and snare, and I'm going to palpate the firmness and the sinuses and percuss the sinuses. Then for the patency, I'm going to code one nostril externally with a finger while patient breathe through the other. Repeat for the other side. So Miss Danica, could you please put your one finger like that and breathe in and out. So for the findings, color of nose is the same with the face, smooth, symmetrical appearance, no changes in ears, with respiration, dry and crusting, septum is midline. Solid placement, no noodles, masses, or pain reported on palpation. Sinuses are non-tender on palpation. Hollow tone is elicited, and both nostrils are patent. Now I'm going to assess the mouth of the patient, and I'm going to check the symmetry and alignment, and I'm going to palpate the temporomandibular of the joint by placing my index fingers over the front of each ear as you ask the patient to open and close the mouth. I'm going to put my index finger on the side of your ear, and I'm going to ask you to open and close your mouth. Is that okay with you, ma'am? Can you please open your mouth? Can you please open So for the findings, lips and surrounding tissue relatively symmetrical and net position and with smiling. No lesions, swelling, and dropping noted. And there is no tenderness upon opening and closing the mouth. Going to assist the lips, the buccal mucosa, the gums, teeth, tongue, and the uvula. And I'm going to look for its color and consistency, the number of teeth, position and condition, and the symmetry and texture movement. So, Miss Danica, I'm going to assess your lips, the buccal mucosa, the gums, the teeth, and tongue, and the uvula. So, is that okay with you, ma'am? We're going to assess your lips. Then the buccal mucosa. Please. Then, can you show me your gums? And the last is the uvula. So for the findings, in the lips are pinkish, red in color, moist, soft with no lesions. In buccal mucosa, pink, moist, soft with no lesions. And in the gums, pink, moist, and with no clearly defined margins. And in the teeth, the patient has 32 teeth, stable fixation, smooth surfaces and edges, pearly white and shiny. And for the tongue is moist and symmetrical appearance, and midline fissure is present. For the uvula is present in the midline position. I'm going to assess the posterior neck of the patient. I'm going to palpate the forehead to the posterior triangle of the neck and the posterior cervical lymph nodes using the finger pads in a slow circular motion. I'm going to inspect and palpate in front of and behind the ears, under the chin, and in anterior triangle to the anterior cervical lymph nodes. I'm going to inspect and palpate the left and then the right carotid arteries. I'm going to only palpate one carotid arteries at a time. And Ms. Danica, I'm going to check your neck. So for the findings, no tenderness noted upon palpation, no swelling of lymph nodes, and carotid pulse is present. To assess the anterior neck of the patient, I'm going to inspect and palpate the trachea. I'm going to palpate the thyroid gland, and I'm going to inspect the ability of the patient to move his neck. I'm going to ask the patient to touch his chin to chest and to each shoulder, each ear to the corresponding shoulder, and then to tip head back as far as possible. Miss Danica, I'm going to palpate your trachea. Then I'm going to palpate your thyroid gland. Then, Miss Danica, could you please move your chin to the chest? And could you please move your chin to each shoulder? Okay, thank you. And each ear to the corresponding shoulder. Okay, thank you. And then the tip of the head back as far as possible. Okay, thank you. For the findings, trachea is in midline position, no enlargement of the thyroid gland, no tenderness with moving the neck.